Hey everyone, welcome back to our channel. Today, we're diving into the world of diabetes and weight management with a look at two groundbreaking medications, Ozempic and Mounjaro. If you've been curious about how these drugs work, their benefits, and what sets them apart, you're in the right place. So let's get started. First up, we have Ozempic. This once-a-week injectable medication has been a game changer since the FDA approval in 2017. But did you know that the FDA approved a brand for weight loss is Wegovy? Confusing, right? Well, here's the thing. Wegovy and Ozempic are essentially the same medication. They both contain semaglutide. It's like having different names, but for the same superhero. So the only difference is in the dosing of the pen needles, but the medicine inside is exactly the same. So moving on, what makes Ozempic so special? So Ozempic contains semaglutide, a GLP-1 agonist. Now, you might be wondering what is exactly a GLP-1? A GLP-1 agonist stands for glucagon-like peptide 1, which is a hormone our body naturally produces in our small intestines. It plays a crucial role in regulating blood sugar levels and the appetite. These like semaglutide mimic the action of this hormone. Ozempic helps your pancreas produce more insulin, which is the hormone that lowers blood sugar levels. It also slows down the movement of food through your stomach and intestines, making you feel full longer. This not only helps control blood sugar, but it also reduces appetite, which is a big plus for weight management. In clinical trials, patients saw significant improvement in their A1C levels, which is a measure of average blood sugar over time. To give you some numbers, those under 0.5 milligram dose lost an average of 2.6 kilograms more than the placebo group. But those on the 1 milligram dose lost an impressive 3.5 kilograms more. And these results show that Ozempic not only is just effective for diabetes, but also for weight loss. But that's not all. Ozempic has also been shown to reduce the risk of major cardiovascular events like heart attacks and strokes in people with type 2 diabetes and established cardiovascular disease. This makes it a multifaceted tool in managing diabetes and its complications. Ozempic's rise in popularity, especially for off-label weight loss, has been very meteoric. Like celebrities and influencers have seen its benefits, and it's not without controversy. Doctors always caution against the off-label use due to the possible side effects like nausea, vomiting, and also pancreatitis. It's crucial to remember that while Ozempic is approved for diabetes treatment, its use for weight loss is considered off-label and might not be appropriate for everyone. Always consult with a healthcare professional. The surge in demand for Ozempic for weight loss has led to shortages, making it harder for people with diabetes to access the medication they need. This has sparked ethical concerns with the medical community. Despite these controversies, Ozempic represents a shift in how we treat obesity. Traditionally, obesity has been seen through the lens of personal responsibility and willpower. However, we're now understanding that it's a complex and chronic disease, and it's influenced by various factors, including genetics, environment, biology. So, Ozempic and other GLP-1 agonists are part of the new wave of treatments that address these biological aspects of obesity. While they're not a cure-all, they offer significant advancements in weight loss management options. The future of obesity treatment will likely involve a combination of medications, lifestyle modifications, and potentially even bariatric surgery for those with more severe cases. Let's talk about Mounjaro, the newcomer that's been approved in 2022 and it's created quite a buzz. But did you know that the brand of tirzepatide approved for weight loss is Zepbound? Yep, you heard that right. Mounjaro and Zepbound are essentially the same medication. They both contain tirzepatide. It's like having different flavors of your favorite ice cream, but it's still the same tasty treat inside. Mounjaro features tirzepatide, which targets both a GIP and a GLP-1 receptor. This dual action approach sets it apart from other diabetes medications. So to break it down, GIP stands for glucose-dependent insulinotropic polypeptide, another incretin hormone like GLP-1. By targeting both GIP and GLP-1 receptors, Mounjaro helps the pancreas release release more insulin, slows stomach emptying, and reduces sugar production in the liver. This multifaceted approach helps better blood sugar control and promotes weight loss. In clinical trials, Mounjaro demonstrated significant improvements in A1C levels compared to Ozempic, but where it really stands out, it's in its weight loss study. Participants treated with Mounjaro lost an average of 16.1 kilograms to 23.6 kilograms, and that's depending on the dosage. But these results are quite remarkable, showing its potential as a powerful weight management tool. So Mounjaro is the first medication to target both GIP and GLP-1 receptors, marking it as the new class of drugs for type 2 diabetes treatment. It's available in 6 different strengths, making it flexible for personalized treatment plans. However, it's important to note that Mounjaro comes with a boxed warning about the potential risks of thyroid C-cell tumors based on findings on animal studies. And although no cases of thyroid cancer were reported in human clinical trials, this warning is something to be aware of. Additionally, Mounjaro is not approved for people with type 1 diabetes or those who have had pancreatitis. Mounjaro's innovative dual approach could revolutionize diabetes and obesity by addressing multiple pathways involved in blood sugar and appetite. It offers a more comprehensive approach to managing these complex conditions. As researchers continue to explore the full potential of tirzepatide, we might see even more personalized and effective strategies for managing type 2 diabetes and obesity. This could include combination therapies, tailored dosages, and more targeted treatment plans. And it's all based on individual patient needs. So, which one's better? According to medical studies, both Ozempic and Mounjaro have shown impressive results in clinical trials, but they each have their own unique strengths. Studies have shown that Mounjaro, with its dual action of GIP and GLP-1 receptors, generally leads to greater weight loss compared to Ozempic. For instance, while Ozempic users experience weight loss averaging up to 3.5 kilograms more than placebo, Mounjaro users saw much higher weight loss averages ranging from 16.1 to 23.6 kilograms depending on the dosage. In terms of blood sugar control, both medications significantly reduce A1C levels. However, some studies suggest that Mounjaro might offer slightly more robust reduction in A1C levels compared to Ozempic. This makes Mounjaro a potentially more powerful option for some patients. That being said, the choice between Ozempic and Mounjaro should not be based solely on efficacy. Both medications come with their own side effects and risks, such as gastrointestinal issues for Ozempic and the risk of thyroid C-cell tumors for Mounjaro. It's essential to have a thorough discussion with your healthcare provider to determine which medication is best suited for your individual needs and medical history. And that wraps up our comparison of Ozempic and Mounjaro. These medications offer promising benefits for managing type 2 diabetes and aiding in weight loss, but they also come with their own sets of consideration and potential side effects. If you found this video helpful, make sure to give it a thumbs up and hit that subscribe button for more health insights. Got any questions or experiences to share? Drop them in the comments below. Thanks for watching and see you next time.